My name is Alyssa Bissonette. I'm the clinic manager and physical therapist at Bay State Physical Therapy in Needham, right over on Rosemary Street. I wanted to provide you a full body exercise program that you could do with little to no equipment at home. I wanted to make sure that everybody's staying safe and still getting strong during this time. We wanted to let you know that we are still open for emergency visits as well as anybody who's having acute pain. If you need anything from us, we're always here. The only things you're going to need for this exercise program are either some soup cans or water bottles. These are about 1 pound in weight. We're going to use these for some of our strengthening exercises. The other thing you are going to need is a chair. Nothing fancy, likely a chair without arms would be better, but if you only have one with arms, that's fine too. For the first exercise, we're going to start to work your shoulders. What you're going to need is either just your hands, or if you want to make it a little bit more challenging, we can use those soup cans. You're going to start with your palms facing backwards, and we're just going to raise our arms to shoulder height and back down, okay? If this is too much for you, you can do one arm at a time and back down, or we can drop the weights all together and just do it with our body weight. You're going to come up and down, all while making sure your shoulders do not elevate to your ears. Our goal for this exercise is to do 3 sets of 10. If that's too much, I just want you to start with 1 set of 10. We're going to continue to strengthen our muscles over time, so if you can work your way up to 3 sets of 10, that's totally fine. Our second exercise is going to be the counterpart to the first one we did. It's going to be called shoulder abduction or a lateral shoulder raise. We're going to take the same approach here. If you want to make it a little bit more difficult, you can use those soup cans. That's how I will show it to you first. I'm going to turn to my side for the best view. If I do it here, I'm going to end up hitting my hand to the counter. We're going to have you turn to the side or wherever you have enough space. You're going to bring your arms out, just again to shoulder height, and back down, okay? Again, if this exercise is too challenging with the soup cans, we can lay those right down. You're gonna bring those shoulders out to the side and right back down. As before, if one or more shoulders is unable to do the exercise, do one at a time. You're going to get the same benefit. Out and then down. Our goal with this exercise is to still do those 3 sets of 10. Again, work towards it. They don't all have to be done at once. We're going to continue to work those arms. Our next exercise is a bicep curl. This works the front of the arm here. We're going to use those soup cans for this exercise. If you have something a little heavier at home and you would like to use that, that's perfectly fine. Arms or soup cans are going to start facing you. You're going to curl up towards your shoulders and again right back down. Again, we can do one at a time. We can do alternating if that feels better for you. Our goal again is to do those 3 sets of 10. I definitely would recommend using some form of weight with this, whether it be 1 pound all the way up to 5 pounds, just so that you can feel the exercise working in the shoulders. We're going to follow this by working the back of the arm now. We just worked the front with the biceps. Now we're going to work the back with the triceps. Again, I would recommend using a weight for this. What you're going to do is you're going to use that chair, or if you have a solid counter surface, you can use that as well. Here, I'm going to use my counter just because it's a little easier and more stable. We're going to turn right to the side here. What you're going to do is start with your elbow locked in at the side, arm bent to about 90 degrees, and we're going to kick that arm back, really squeezing when you get to the end. Then back up and really squeezing when you get to the end. You want to make sure that you're really trying to get that elbow nice and straight each time. Again, with this exercise, we're going to have you try for that 3 sets of 10. With this one, because the hand is on the counter or on the chair, I would definitely recommend you doing 1 arm at a time for this exercise. We're going to follow this up with a row. I'm going to call this a bent over row just because we're using the soup cans as our only piece of equipment here. What you're going to do is you're going to take the soup can in the position we were just in for that tricep exercise. You're going to start with the arm down. You're going to bring up, squeeze those shoulder blades together. Squeeze those shoulder blades together, okay? If you feel stable and you don't need to hold on to the countertop, you can definitely do both together. Sometimes for this exercise, we recommend using a little bit more weight. Totally depends on your capability. I don't want you to hurt yourself. So anything from 1 pound all the way up to 5 pounds, or even more than that if you feel comfortable. Again, our goal for this exercise is going to be that 3 sets of 10. The last exercise in this upper body exercise routine is going to be what I call a counter or a wall push-up. There's a couple different versions of this. I'm going to show the one on the counter, but I'll also talk about a progression and a regression. You're going to use a solid surface like a countertop. I would advise using against the chair only because that usually moves. Counter, we know, will stay stable. You're going to put your arms here, core nice and tight, and you're going to push down and up. Making sure to not do what I call the turtleneck, which is really reaching that neck out. Keep it nice and tucked down, coming down and up. If you feel like this is too much for you, I would recommend just upping the height, so whether that's a higher counter or even the wall. If it's too easy for you, you can go down to something a little bit lower, such as your dining room table or even a couch. The arm handle of a couch will sometimes work for this. Whatever you use, I want to make sure you're safe. So please use something that's either against the wall, so you're not going to push yourself over, or something like a counter that's stable. We're going to get into lower body exercises now. The first set of exercises we're going to do is what I refer to in clinic as the 3-way hip. It's going to work your hip in 3 different directions, going forward, out to the side, and backwards. This achieves strengthening of all major muscle groups in the lower extremity and is really the best and safest way for you to do these exercises at home. Again, as always, we're going to aim for 3 sets of 10. Sometimes what I recommend is to do all of the exercises on one leg so you don't find yourself shifting from side to side and getting dizzy. I would also recommend, if you need to, cut them down into smaller sizes. So you can do 5 at once, you can do 10 at once, you can do 15 at once. Our ultimate goal is to get to that 30. If you don't feel like you can make it there, that's totally fine. Start with 10 or 20 and just work your way up. For this exercise, you're going to be kicking out to the side. I would recommend doing 1 leg at a time. As always, we're going to work for those 3 sets of 10. Make sure to remain upright while you're doing this exercise. Now we will kick back. Again, make sure you're kicking your leg back, squeezing that buttocks. I would recommend doing 1 leg at a time for this exercise. As always, 3 sets of 10. Our last is hip flexion. You're going to lift your knee up to about hip height. You can alternate if you'd like. As always, we're going to do those 3 sets of 10. For the last couple of exercises, we're going to use the chair. The first exercise we're going to do is what we refer to as a long arc quad. For this exercise, you're going to be seated. You're going to kick one knee straight out in front of you, making sure to straighten the knee as much as your leg will tolerate. You can alternate sides, do all on one side, whatever you'd like. We're going to aim for those 3 sets of 10. Our final seated exercise is a seated march. You're going to alternate or do 1 leg at a time, lifting the knee towards the ceiling. As always, we're going to be trying to go for those 3 sets of 10. For this last exercise, we're going to do what I consider to be one of the most important exercises of all time. It is called a sit to stand. Very simple. You're just going to sit and stand. It assists with activities of daily living, toileting, getting on and off your bed, getting on and off chairs, getting in and out of your car, and I would say it's the basis of all of our exercises, really, for lower extremity strengthening. I think it's the most important one, if you're going to do any of these exercises, to at least do this every single day. What you're going to do, I would recommend getting a chair with outside arms, just so that you're not having a tendency to push off of that. You're going to cross your arms across your chest or leave them straight out, whatever works for you. Feet are going to be shoulder width apart. I like to put my hands across my chest, so that's where I'll be. And you're going to go ahead and stand on up, okay? You're gonna slowly lower yourself down to the seated position again. If you find that that's too difficult for you, what I recommend is to put a pillow right underneath your bottom. That will give you some height and allow you to stand up more easily. Some people may need 2 pillows. I've started my patients off with 2 pillows, down to 1, down to none. So again, this is a progression. I want you to make sure you're safe when you're doing it. So if you feel uncomfortable, if your knees hurt, if your ankles hurt, if you feel like you're going to fall over, please don't do this exercise unless somebody is there with you. Again, with this exercise, our goal is 3 sets of 10. What I usually tend to recommend is just 10 per day until you can get to about 15 and then perhaps 20. I don't expect you to be able to do all 30 in one day, but that is our ultimate goal. Questions or concerns? Definitely feel free to reach out to us. We're here for you in this difficult time. I put together this exercise program to make sure that you had something to keep you healthy, safe, and energized during this time. Please let us know if we can be of any assistance to you, and our contact information is on the final slide. Thanks so much. I hope you all have a great day and stay safe.